Certainly this time of year, children don't want to hear about going back to school, but as responsible parents, now is the time to think about making sure your children are up to date on school immunizations. Erie County Health Commissioner Dr. Gale Burstein is back with that information. Hello, nice to have you back.
Good morning.
And I understand that we're talking especially about 3 different vaccines.
Right, so the HPV that protects you against human papillomavirus, which causes cancer. There's Tdap, which protects you against pertussis, which is whooping cough. And even children and adults get whooping cough. And then against a vaccine that protects against meningitis, the Meningococcal vaccine, that can, really devastate a person and actually kill them. It's a blood infection that is very, very serious and travels very, very quickly. So all of these vaccines have killed people. All the vaccines protect against diseases that can kill people and make them very ill.
It says that 14 million people, including teens, become infected with HPV each year. That can cause cervical, vaginal, vulvar cancers in women and penile cancer in men. HPV can also cause anal cancer, throat cancer, and genital warts in both men and women. And that's why it's given now to boys and girls. Right.
Actually, the HPV infection is the #1 cause of throat cancer. It causes more cases of throat cancer than tobacco products.
Wow.
And we're seeing an increased number of throat cancers, especially in men, every year. So we're up to about almost 9,500 cases a year. So it's a very serious infection.
We have an opportunity to get these vaccines, to protect your kids. So again, by all means, this is the time to make that doctor's appointment before they go back to school. Also, flu shots for teens.
Right?
Let's get those done.
Yeah, everybody needs a flu shot. So August, they start to become available in the pharmacies, or usually your doctor's offices get them a little bit later in the fall. And, as long as you get them, ideally sometime before the end of October is really the best time. So we know that flu can make people very, very ill. You are going to be in bed for 2 weeks.
Oh, yeah.
And then also there are some people who have risk factors, other health problems that can make them very, very ill and require hospitalization, and sometimes people even die. So there's no reason not to get a flu vaccine.
For kids, can they take the one in the nose and the non-shot version?
Well, actually what's new one of the things that are new this year is that the nose spray vaccine is available again. We don't have really good data about how this new vaccine performs. So if you can get the shot, that's recommended. But for people that otherwise won't or can't or get the shot, then the nose vaccine is okay within the stipulated age groups.
All right, and listen, if you're having problem paying for those vaccines, there is a Vaccines for Children program.
Right, for kids, the VFC program. So those vaccines are fully covered for people through the age of 18. Also, for some adults, Medicaid covers vaccines, and also there is a vaccine for adults program that some people can be eligible for.
That's good to know.
Yes.
That's going to help a lot of people. And as we get back to your dose of meningococcal vaccine, that actually, there's a second and a third dose that will need to be administered, so make sure you ask your doctor about that.
Right. Well, actually, if you get the doses as scheduled, you only need 2 doses.
Okay.
So the first dose should be around 12 years of age. Sometime between 12 and 16 years of age. And then if you get that dose before 1 dose before 16, you just need a second dose after 16.
Okay. And
what's confusing is now there's a new meningitis vaccine that protects against a strain not in that already established meningitis vaccine. So the current meningitis vaccine protects against 4 strains, A, C, Y, and W, and then this new vaccine protects against the B strain.
Okay.
So that's not required for schools. We see a meningitis B. We've had a case this year in New York State already in a college. So, again, it can kill people. I got my kids immunized. I figure it's, even though it's not required for school, I thought, oh my gosh, if that happened to my children, it would be something that I could
know that it's
prevent.
available.
Yeah.
Right.
So ask your pediatrician.
And by the way, congratulations on being the top health department, what, in the country?
Yes. Yeah, Erie County last week received the Local Health Department of the Year Award from the National Association of County and City Health Officials. So we're being recognized for the good work that we do, especially around opioid overdose prevention.
Congratulations.
Thank you.
Very well deserved.
Yes.